Coming up, we will be on location at Revive in Washington, D.C., discussing the latest advances in treating migraines through neuromuscular dentistry and how it can help relieve those painful and lingering migraine headaches with two of this area's top dentists, Dr. Shila Yazdani and Dr. Michael Mortazie. Dr. Yazdani is a member of the American Academy of Implant Dentistry, the American Academy of Cosmetic Dentistry, the Dental Organization for Conscious Sedation, the Academy of General Dentistry, and has received extensive dental training at the world-renowned Las Vegas Institute for Advanced Dental Studies. Dr. Mortazie is a member of the American Dental Association, the Virginia Dental Association, the American Academy of Cosmetic Dentistry, the American Academy of Implant Dentistry, the Dental Organization for Conscious Sedation, the DC Dental Society, and he has also received extensive dental training as well at the world-renowned Las Vegas Institute for Advanced Dental Studies. Both of these doctors are recognized as top doctors by the Consumers Research Council of America. Welcome, Dr. Yazdani and Dr. Mortazie.
Thank you. It's great to be here.
Thank you. It's great to be here.
Oh, it's our pleasure to have you both on. We've got so much to talk about. I understand there's going to be a patient and her husband, in fact,
yes,
who's going to be joining us in a few minutes. So let's just start right off the bat, if I may, by asking you, Dr. Yazdani, to tell us how common are migraine headaches and what causes them?
That's a great question, Rocco. It has been estimated that 1 out of 10 Americans do suffer from migraine headaches.
That's a significant number. You're talking about millions of people.
Exactly. And the research has shown that 90% of headaches are muscle related.
I wanted to ask you, Dr. Mortazie, what are some of the typical symptoms that most people experience related to these headaches?
Well, most people experience headaches, facial pain, dizziness, visual disturbances, ringing ear, tingling in the fingertips, and vertigo. Those are just some of the typical signs and symptoms they feel. Some people even grind their teeth or chip and break their teeth. But a completed list is much wider than just these few.
So it's a lot more broad as far as
Absolutely.
the symptoms that one would think.
Absolutely.
And I wanted to ask you, Dr. Yazdani, on that note, if I may, what is neuromuscular dentistry and how does it relieve these migraine headaches?
Well, neuromuscular dentistry is dentistry that focuses on the proper and ideal alignment of the jaw joint, the bite, and the muscles of face, head, and neck.
I wanted to ask you, Dr. Mortazie, if you can please describe the process that a patient would be looking at if they underwent the neuromuscular dentistry therapy.
Yes, typically the patients who find us, they come in for a consult initially, at which point we take a look at their bite, we take a look at their proper relationships of their head, neck, upper shoulders, their bite, and the jaw joint. We also take a look at some x-rays possibly, study models, things of that nature. We go through a detailed questionnaire with them, with their signs and symptoms. We take a detailed look at that. And from that point, we move on to whatever treatment may be needed.
And I understand that there's technological advances which allow you now to diagnose these various issues that one suffers from that could be causing these extreme migraine headaches in a manner that could not have been done, say, a few years ago. Is that correct?
Absolutely. We have specialized computerized equipment on the cutting edge technology that allows us to actually verify all these things, figure out how far the muscles are off, how far the bite may be off, what's the extent of the damage, and how we can approach their treatment so they get the benefits as quickly as possible and with assurance.
Could you elaborate for a few moments, Dr. Yazdani, on some of the specific technologies that Dr. Mortazie was just talking about that help in the diagnosis and treatment offerings?
Definitely. The computer program that we have does take many different scans, and they're in different categories. One of the category of the scans that we take is called the EMG scans. Basically stands for electromyography. In this scan, we get to look at the activity of the muscles of the face, head, and neck. And then we'll see if a muscle has been overworking or not really responding, or it's just been too tired because of the misalignment that it has been through over many years. The second scans that we take are the sonography of the jaw joint. Basically, we listen to the jaw joint and we pick up sounds such as clicking or popping, no matter how big or small they may be, because that will help us in diagnosing and come up with the correct route of treatment for the patient. Another scan that we take, it's called the jaw tracking scans, where we look at the movement of the jaw and the bite in 3-dimensionals. And we see if the patient does have any limitation in this 3D scans that we take. And again, that helps us to come up with the correct route of treatment. The last scans that we do, or the treatment diagnosis that we do, is called the tensing, where we relax the muscles of the head and neck and face. And it takes about 45 minutes. And after that, we will take a snapshot of where this proper alignment should be, so that the jaw joint, the bite, and the muscles will be aligned in the ideal position.
So basically, Dr. Yazdani and Dr. Mortazie, what you've said thus far, and correct me please if I'm wrong, is basically neuromuscular dentistry treatments that you've already discussed here are looking to create a balance and harmony within the mouth and between the muscles and the teeth and so on and so forth. That is the area that where the tweaks and the corrections in these treatments are needed to result in that balance and harmony, which eliminates or at least relieves these migraine headaches that we're talking about here today, if I'm not mistaken.
Absolutely.
Absolutely.
Yes, yes.
In neuromuscular dentistry, we actually look at the body